This is the baby's head, and this is the baby's spine, which seems to be crossing the maternal spine. This woman must have been in labor when this radiograph was exposed, which is evident from the fact that the baby seems to be jammed in the pelvis, with crowding of the ribs which are on the side away from the pelvis and flaring out of the ribs which are towards the pelvis, as seen in cases of scoliosis in adults. The elbow of the baby is seen as the presenting part. The pelvis seems to be adequate. Here is another fetus in transverse lie. This one is a less common presentation. Here the baby is in acromio superior transverse lie, the maternal spine. This is the baby's head, and this is the baby's spine, which seems to be crossing the maternal spine. The baby's lower limbs are felt on a vaginal examination, and even on this radiograph, a misinterpretation of a breech with footling presentation can be made, which can be avoided when one checks that the baby's spine is crossing the maternal spine. The pelvis seems to be narrow at the level of the mid pelvis. This is another case of acromio superior transverse lie, which can be mistaken for a breech presentation. The attitude of this fetus is that of extension. This is the baby's head, and that is the baby's spine, which is not crossing the maternal spine, and this is a breech presentation rather than a transverse line. However, if this portion of the spine had crossed a little bit, then this would have been a flying fetus, a transverse lie in an attitude of extension, which is an uncommon presentation. This is a radiograph of a pregnant woman with the fetus in breech presentation. The baby's head is seen in the upper part of the radiograph. The baby's spine is seen, and the baby's lower limbs, the femurs and the tibias and fibulas are seen. This breech is a frank breech. Another point of interest is the area of the cervical spine, which is partially extended, giving the baby a straight forward looking appearance, what is popularly known as the military attitude of the breech. Here is another radiograph of a breech in military attitude. The extension of the cervical spine is quite evident in this radiograph. Here is a breech with extreme extension of the cervical spine as seen over here. That's the baby's head, and that is the cervical spine, which is quite extended. This gives the breech an appearance which is popularly known as a star-gazing breech. If such babies are delivered vaginally, the neonatal mortality is 25% or more due to severe injury to the baby's cervical spinal cord. Here is a fetus which is preterm in breech presentation, which is complete type. The point of interest is the baby's head. This fetus has microcephaly. Another area of interest is the baby's thoracolumbar spine junction. The sudden angulation seen over here suggests that the baby also has a spina bifida in this area. However, a clearer view would be essential to make such a diagnosis. An ultrasonography is diagnostic anyway in such cases. This is a case of a breech presentation with the fetus having a massive hydrocephalus. The outline of the baby's skull is as follows. The skull bones are thin, the fontanelles are wide and the suture lines are wide. Otherwise, it's erroneous often to make a diagnosis of hydrocephalus in a breech presentation because there can be a magnification effect in case the baby's head lies closer to the source of the X-ray as compared to the rest of the body, which is not likely to happen in a cephalic presentation. The skull bones are not seen very clearly, mainly because they are thin rather than poor exposure. Okay. Here is a radiograph which is unique in the sense it is normally not obtained in modern obstetrics. Here is a baby in breech presentation which has delivered up to the neck and the head is still retained. A radiograph was obtained in order to find out the cause, which is a very large hydrocephalus. In modern obstetrics, such a diagnosis is made in advance by ultrasonography and need for such a radiograph does not arise. The baby's body outside is also seen. The thoracic cage and the ribs are seen clearly. Here is a radiograph of a pregnant woman with the fetus in face presentation. The outline of the baby's head is seen quite clearly. This is the forehead of the baby, the nasion, the orbits, the nose and the mandible. With further progress in labor, it would extend further and then the pelvis being adequate could be expected to deliver vaginally. One cannot make out mento-anterior or mento-posterior difference on an antero-posterior plate and one needs a lateral radiograph for the same. Here is another radiograph of a fetus in utero in face presentation. The baby's facial structures are seen quite clearly. The vault of the skull is also seen clearly and a diagnostic feature, another one, is the cervical spine, which is in an attitude of complete extension. Such a fetus, if turned through 180 degrees, becomes a stargazing breech. Now here is a fetus in bra presentation. The outline of the skull of the baby is very clearly seen. This is the position of the anterior fontanelle. That's the nasion and this is the frontal bone. These are the facial structures. This bra presentation is gradually changing into face presentation, and this is that in between stage. The cervical spine, as in face presentation, is extended. The degree of extension in brow presentation is less as compared to that in face presentation. Here is a fetus in compound presentation. The outline of the baby's head is quite clear. An upper limb of the baby is seen, humerus, elbow joint, radius and ulna, and the hand. The fingers are seen clearly below the presenting part. This is compound presentation, the commonest type, vertex with an upper limb. Here is another radiograph showing a fetus in compound presentation, vertex with an upper limb. The elbow and the forearm of the baby are seen quite clearly alongside the presenting part. The hand of the baby has been masked by the image of the fetal skull. Now here is a very unique radiograph which is not often found. The baby seems to be apparently in breech presentation with the baby's head in the upper part of the radiograph, the cervical spine, the thoracic spine. The lumbar spine seems to have taken an acute curvature, giving it a Z-shaped appearance. Such a curvature of the baby is not possible unless it is dead and macerated so that the spine is hyperflexed. However, this fetus does not have any other signs of intrauterine fetal death. This was a case of ruptured abdominal wall hernia, a gastroschisis, in which the liver and small bowel of the baby had been extruded out and the woman was in labor so that the baby was jammed into the pelvis. This is not a breech presentation but a transverse line because the baby's spine is crossing the maternal spine. She had to be delivered by internal podalic version. Here is a breech presentation. The only point of interest is the attitude of the baby. The head of the baby is laterally flexed over the trunk rather than forward or backward. Here is a neural tube defect, an anencephalic monster near term. The base of the baby's skull is seen, that's the mandible of the baby. The vault of skull is missing totally. Remaining part of the baby appears normal. The cervical spine, the thoracic spine, and the lumbar spine. These babies can have open spina bifida and they can also have congenital Talipes equinovarus. However, it's quite difficult to detect the equinovarus on a radiograph. This baby's spine is entirely normal. Here is an anencephalic fetus which is preterm in transverse line. The spine of the baby is seen crossing the maternal spine. Anencephalics often have associated hydramnios which causes a transverse line. The preterm nature at the time of presentation also predisposes to a transverse line.